Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering oppositional defiant disorder. Now, my last video where I covered conduct disorder, I told you you're going to have to know the difference between conduct disorder and ODD, oppositional defiant disorder. And I promised a video, so here it is. Before we get started, guys, please support me, support this channel by liking this video, press that thumbs up button, subscribe to my channel if you haven't done so already. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. This is going to be a very short video, straight to the point. So, oppositional defiant disorder, look what it says. There are children and adolescents whose behavior surpasses the boundaries of what is socially acceptable. Oppositional defiant disorder impacts both emotions such as anger and irritation and behaviors such as argumentative and defiance. So the child may have these emotions such as irritation, but they may not act on it. When it comes to ODD, not only do the patient have those strong emotions such as anger and irritation, they, actually act out on it, okay, such as argumentative and defiance. Now, child or adolescents with oppositional defiance disorder is not just difficult or defiant. This disorder impairs the child's life and makes it extremely difficult for him or her to attend school, to have friends, or be a functioning member of the family. So let's stop there for a minute, guys, because remember, the work of the child is play. That's how they learn about their environment. The work of the adolescent is socialization. That's how they learn about themselves. Remember, their job is self-identity, right? So the children and the adolescents that have this disorder, it affects their daily life. They can't play appropriately to learn about their environment if they're a smaller child, and they can't socialize and keep friends and have those friend groups appropriately if they're an adolescent, okay? They can't be a functioning member of the family. They usually skip school or even drop out. Children and adults with oppositional defiant disorder show a preference for large rewards, and they pay little attention to increasing penalties. So they'll decide to rob a bank because they're thinking of all the money that they can get, and they could care less about the chance of going to jail. Look at the DSM-5 criteria for being diagnosed. A pattern, so this has to be something that we're seeing consistently, right? A pattern of angry or irritable mood, argumentative, defiant behavior, or vindictiveness, trying to get revenge or payback for something they perceived as a wrong against them, right? Vindictiveness lasting at least 6 months, as evidenced by at least 4 symptoms from any of the following categories, and exhibited during interaction with at least one individual who's not a sibling, because we know siblings fight, right? So with one individual that is not a sibling. Now look at these categories, guys. Angry or irritable mood. They lose their temper very quickly. They're often touchy, easily annoyed. They're often angry and resentful. They feel like the world's against them. Argumentative or defiant behavior. They often argue with authority figures. For children and adolescents, they argue with adults. Often actively defies or refuses to comply with the requests of authority figures, such as parents or teachers or even police officers. Often deliberately annoys others. Often blames others for his or her mistakes or misbehaviors. They never take accountability for their actions. And look, vindictiveness, being spiteful or vindictive at least twice within the past 6 months. So that gives you a picture. Let's look at the epidemiology. Oppositional defiant disorder is typically diagnosed around 8 years of age, but it can be seen as early as 3 and usually not later than early adolescence. By the time they're in early adolescence, we've seen a pattern of this type of behavior if they've got it, right? The prevalence of oppositional defiant disorder is globally consistent and similar across race and ethnicity. Comorbidity. Conduct disorder, that's the other video that I did. If you haven't watched it yet, make sure you go watch it so you can compare and contrast the differences. Conduct disorder, which we'll discuss later, I did already, and oppositional defiant disorder are both related to conflict with adults and authority. They don't want anyone telling them what to do or how to live. The difference between the two is that conduct disorder is more severe and includes aggression towards people or animals, destruction of property, stealing, and deceit. Also, the emotional dysregulation, such as anger, irritability, and oppositional defiant disorder, is not present in conduct disorder. And one of the reasons for that, guys, you'll know after you watch my video, in conduct disorder, we see those antisocial personalities where they'll be a social chameleon, okay? Treatment approaches, psychosocial interventions. Psychosocial interventions include parent training. The parents absolutely have to be involved, okay, in the therapy. Parent training, group therapy, anger management, cognitive behavioral approaches are also helpful. When treating preschool children, because remember, we can see this as early as 3 years old. When treating preschool children, parental intervention is an essential, a very important component. Home visits and programs such as Head Start can reduce future oppositional behaviors and delinquency. And last, let's look at the pharmacological treatment. The the FDA has not approved any drugs for the treatment of ODD. Medications available for ODD are primarily used to control the anger and aggression rather than the disruptive behavior. And guys, that is your oppositional defiant disorder in a nutshell. Please make sure you go back and watch conduct disorder if you haven't done so already, because you will be expected to know the differences. Let me know what you thought about this video in the comment section. Let me know if there's anything you'd like to see me cover or cover more extensively. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. Thank you so much for watching this video, and you guys will catch me on the next video.